Hi everyone, welcome to Doc Dynasty. Don't forget to comment and subscribe. Let us talk about this article that just came out from AARP magazine. And where have all the doctors gone? So very interesting. We've been talking about some of these subjects, but one of the things that the article brings out among many is how long does it actually take for you to see your doctor? Ends up the average is 26 days. So not only does it take 26 days, but if you're in an emergency situation, it actually takes 6 days to see a doctor, meaning you're triaged by a nurse and then maybe you'll get to see a doctor. So these are crisis proportions. And why is it that we can't see our doctor sooner? So in a nutshell, it's because doctors are moving out of the profession for various reasons that we're going to talk about. They're also graduating less doctors, and doctors are choosing to be in professions that don't see day-to-day patients. So let's look at a few of these topics. Why is it happening? Number one, financial. It as we've talked about in a few episodes, the average doctor's pay is going down if you stay in private practice, meaning we're being reimbursed per code less than we ever have, whereas inflation is going up. So we're being paid 2.1% less per code. Inflation, meanwhile, is rising. Number two, a lot of the private physician practices over the last 3 years have been brought up by private equity companies and large companies like CVS and Walgreens, among others, Optum RX. And Optum, United Optum as well. What happens is when a large corporation buys up a practice, that practice no longer is based on patient care. It's based on a financial relationship that this corporation has with this doctor. Their sole purpose is to get that doctor in, pay them to see more patients. Quality of care does not figure into all of that, and how the physician wants to treat that patient does not figure into it. It's normally 15 minutes a patient, 1, 2, 3, 4, 5, all day long. And so it becomes a profit center versus a patient care center. So number one, doctors are being overbooked. Patients are not getting the care that they need. And doctors are now getting burned out. So by doing that, you're seeing less and less doctors. Number two, in 1980, there was a dictum that said to teaching hospitals that we were graduating too many doctors. And what they didn't count in that is that the population was actually growing. So they were basing it on current numbers and not future numbers. And so what happens? In 2020, we started to run short of doctors. So to catch up, that means you have to readmit or admit new doctors who now have to go through a process of 4 years of medical school, 1 to 3 year residency, and then a fellowship. It's a decade before you're seeing those doctors by the time you have a crisis in the number of doctors practicing. Number three, a lot of the doctors now do not want to do day-to-day patient care. So they're entering medical fields where they don't have their own patients, like radiology, like research. There are other fields in there. So you have less and less doctors practicing patient care. So we're at a crisis because private practice in the United States is the gold standard of medical care, and we are getting less and less of that, and we're not graduating and seeing enough doctors who are treating patients. And remember, doctors enter this because it's their passion. They often graduate with multiple six figures in debt for a reason. This is what they want to do. And so financially and length of time wise and debt wise, it's become a harder and harder thing for physicians to see private patients. So that's where your doctors have gone: less graduating, more moving into private equity groups, and more just burning out and not wanting to practice. So To start things anew, we need to change the way medicine is practiced back to how it was practiced, meaning let the doctor decide how to treat the patient and how much time. Return doctors to private practice, incentivize them to do that, and pay them a fair amount. One of the things that can surely be done is tying Medicare reimbursement to inflation. It would make physicians fairly paid. And most importantly, patients will be able to see doctors and be treated well. Meaning, even if they have complicated medical conditions, there's an incentive to see that patient because the doctor is allowed enough time to figure out what's going on. So where have all the doctors gone? This is where they've gone. They've gone away from medicine for the particular reasons we've talked about. I'd love to hear your opinions. Of course, comment, share, subscribe. Your opinions are always important. Thanks for sharing.